Okay, I'm gonna start by checking the prescriber's order for check if it's complete and check if it's accurate. I'm gonna check the patient's name, the drug name, the dosage, the route, and the time. After I've completed that, I will perform hand hygiene and close the door, explain the procedure to the patient. I will get my medication sheet and have it with my supplies. I'll also ask the patient if they have any allergies, and this is because I can only prepare medication for one person at a time. After I've done those steps, I will get my medication and compare it with the medication administration record and compare it to my medication sheet. I would have also calculated my dosage, which is 2 milliliters. And after I've done that, I'm going to assemble my needle, and I'm going to need a 3 milliliter syringe with a 1 to 3 inch needle and a 20 to 25 gauge. And after that, I'm going to check my medication another time against the medication administration record and my medication sheet, and then I would scan my patient's get her his 2 identifiers, and I scan their bracelet. If they did not have a bracelet on, I would not give them medication. After I've confirmed that this is the medication that I'm going to be using, I'm going to clean it vigorously with the alcohol swab. And I'm going to put my gloves on while I'm waiting for that to dry. Wait. Go back. Oh, I'm sorry. I'm going to take my needle out. I'm going to wait for that to dry. It's dry. Typically, after I got my medication, I would typically change needles. However, I do not have that choice because this is the only needle I have for this syringe. Okay. This is 2 milliliters. Make sure it focuses. Okay. I'm going to now I'm going to don my gloves. I'll choose my where to administer the medication my patient depending on the length of the needle and how many milliliters I'm going to be administering. Since this is 2 milliliters, I can give it on the rectus lateralis, the rectus femoris, both of them are 2 milliliters, or I can give it on the dorsogluteal, which is not highly recommended. I would do that only in the last resort. And I can also give it at the ventral gluteal, which is the 3 milliliters. Well, dorsogluteal and ventral gluteal, both 3 milliliters. Okay. I'm gonna do the Z-track method. So I'm gonna pull over on my patient's skin 1.5 to 2 inches, and I'm going to take the alcohol swab and start in circular motions going out. And I'll wait for it to dry. Okay, it's dried. Okay, I'm going to go in the drying motion. It's going to be a little hard because this is cloth. And I'm going to try my best. Okay, there we go. And I'm going to anchor with my non-dominant hand. And I'm going to insert it. Okay, I'm going to leave it for 10 seconds. interlace both of them at the same time. And then after that, I would take my gloves off, perform hand hygiene, and I would document how the patient handled the procedure and when I did the procedure and where I administer the medication. And that's it. And I'm gonna do the intramuscular sites now. Okay, I'm gonna start with the deltoid. I'm gonna go 2 to 3 breaths below the common process. And then I'm gonna draw along to from the axillary, and it'll be right here. In the medius part of the deltoid, it'll be no more than 1 milliliter. And then the second would be no. First one. The second would be the ventrolaterales, and I'll have one hand spread above the knee and one hand spread below the greater trochanter, and in that midline be where I'll inject the medication. It'd be no more than 2 milliliters. And then the anterior, not the anterior, the rectus femoris would be it would be in the middle between the patella and the iliac crest, the anterior superior iliac crest. It'd be right here, and it would be 2 milliliters also. And then the next one would be the ventrogluteal, and I'll make a V with my fingers. One finger pointing towards the anterior iliac spine, and the other one it would be right over the greater trochanter. The other one would be pointing towards the anterior superior iliac crest, and in that V it would be where I'd administer medication, and it'd be 3 milliliters. Last one would be I'll draw an imaginary line from the greater trochanter towards the posterior iliac spine, and just below that it would be where I would administer the medicine. I would measure the injection to be no more than 3 milliliters also.